All right. Thank you all for being here today. My name is Sarah Webb. I'm a Senior Technical Officer at the Reproductive Health Supplies Coalition, where I support our menstrual health supplies workstream along with a couple of other scopes of work at the coalition. We are incredibly excited to welcome all of you today to our very first webinar in a joint series of webinars that we are hosting this year. This webinar series is focused on market-based approaches for menstrual health and is being co-hosted by our Market Development Approaches Working Group, as well as our Menstrual Health Supplies Workstream. In our first webinar today, we will be focused on scaling access to menstrual products in the Global South, a market-based approach, which we are co-hosting with Hystra. Before we get started, we wanted to give everybody a quick orientation to Wordly. Wordly is an AI software that we will be using for today's webinar to enable translation into over 50 different languages. There's a couple of different ways that you can access Wordly. If you would like, you can scan the QR code that is showing up on the screen and open Wordly on your mobile device, or you can copy paste the URL that was just put into the chat to open Wordly in your web browser. And if you do already have Wordly installed, you can also access Wordly through Zoom itself. Throughout the webinar, you can control which language you want to hear or want to see the translations in. So you can select your preferred language using this instruction here in step 2, and it will create live captions for you to follow along in the webinar. We have uploaded a glossary of terms to Wordly, but it is still an AI software, so it sometimes does make mistakes. So please do bear with us as it continues to learn and make improvements. And with that, I am incredibly excited to introduce our first speaker, Ntinda Luwembe, who will be providing opening remarks in today's webinar. Ntinda is the Director of Implementing Mechanisms and Initiatives at the Reproductive Health Supplies Coalition, where she also oversees our membership strategy and supports the Market Development Approaches Working Group. Ntinda has robust experience in fostering enterprise capacity, market access, managing business finance, sales and distribution, and cultivating public-private partnerships across challenging and complex environments, including prior roles at MSI Reproductive Choices and the World Food Program in Zambia. And Ntinda, I will hand it over to you.
Thank you, Sarah. I hope you can hear me.
Yes.
So thank you everyone for joining. Good morning, good afternoon, or good evening, depending on where you're joining us from. As Sarah mentioned, I am Ntinda Luwembe, and I'm joining you from Lusaka, and I am RHSC's Director of Implementing Mechanisms and Initiatives. Unfortunately, due to bandwidth issues and just to make sure I'm audible, I'm going to have to go off camera just to make sure, I'm part of the conversation. So just bear with me. Okay. And as Sarah mentioned, I have a wide range of duties, but among my duties, I backstop our Market Development Approaches Working Group. And it's my privilege to welcome you to the first in a series of webinars that you will see coming through this year. And I am particularly excited about this from a membership point because, as you know, the Reproductive Health Supplies Coalition has a wide range of different actors coming from the public, private, and third sector. And we also have those members joining our Market Development Approaches Working Group and our menstrual health work streams. So seeing them come together for this, seeing them come together to collaborate on this webinar was a fantastic feature. And today's webinar, of course, rightly titled Scaling Access to Menstrual Health Products in the Global South, a Market-Based Approach, I think sums up what that collaboration looks like. So first and foremost, I'd like to extend my gratitude to our distinguished speakers, members of the Reproductive Health Supplies Coalition, members of our Market Development Approaches Working Group, and the Menstrual Health Work Streams, who brought this, lovely webinar to you today. And of course, I want to thank you in our audience today. Your participation is vital as we embark on this journey to tackle one of the most pressing challenges in reproductive health and gender equality. Your presence here today is a testament to the commitment and dedication that you hold. And I think conversations like these will help us move forward collectively. Despite significant progress in recent years, we know that an estimated 500 million menstruators still need access to information and essential purpose-made menstrual products and services. According to RHSC's LEAP report, this gap is most pronounced in low and middle income countries, where between 38 and 61% of menstruators are not using purpose-made products. Now, that number is not just, it's not just significant in letting us know how real the situation is, but it is a reminder of the urgent need for innovative solutions. While menstrual health markets present unique challenges, they also present significant opportunities. Unlike other health commodity markets, the menstrual health product market is consumer-driven and expanding rapidly. For instance, in India alone, the sales volume of menstrual products is doubling every 5 years, yet it only meets about 10% of the potential market, and that means there's a huge untapped market that needs to be served. The rapid growth emphasizes the need for a market-based approach to achieve scalability and sustainability to meet future demand, introduce new products to provide choice, while driving impact to ensure that menstrual products are available to all people who need them most, particularly the vulnerable or marginalized members of different communities. Addressing menstrual health complexities requires innovative and sustainable approaches in which this collaboration will play a crucial role. The collaboration between our Market Development Approaches Working Group and the Menstrual Health Supplies Workstream was forged to address the challenges that I have outlined. This partnership began during the Reproductive Health Supplies Coalition General Membership Meeting that was held in Accra, Ghana last year, with a collective goal to enhance equitable access to a wide range of quality, affordable menstrual health supplies through market-based strategies that leverage the public, private, and third sector actors. The Market Development Approaches Working Group focuses on the total market and aims to facilitate movement up the value chain from subsidized to non-subsidized products, while also growing the market and improving equity through targeted subsidies and a strengthened private sector. Our Menstrual Health Workstream provides a crucial forum for discussing these challenges, sharing expertise, and forging a common language around menstrual health supplies to ensure that coalition members and respective sectors have a shared sense of urgency, awareness, and recognition of the state of menstrual health supplies. Implementing a market-based approach is not just an option, but a necessity. It aligns with economic principles, ensuring the sustainability of supply chains and adapting to the evolving market demands and conditions. Through such strategies, we can create a sustainable ecosystem where menstrual health products and services are not only accessible, but are continually improved to meet the evolving and diverse needs of their users. I'm really confident that today's discussion will enrich and pave the way for collective problem solving. Thank you once again for joining us today. I now have the pleasure of passing the floor on to Sarah. Thank you so much.
Awesome. Thank you so much, Ntinda. For our next speaker, I am also incredibly excited to introduce our co-host for today's webinar, Jean Charbet. Jean is a project manager at Hystra and co-author of several reports in the field of menstrual health, including Scaling Up Access to Menstrual Health in the Global South, a business case for selling reusable menstrual health products in the Global South, and most recently, exploring synergies between family planning and menstrual health interventions. Jean, I will hand it over to you for the first part of our presentation today. Thank you.
Thank you very much, Sarah, and thank you everyone for joining this webinar today. We are very excited to kickstart this series of webinars by sharing some of our insights from some past reports that Sarah just mentioned. So if you could go to the next slides. And the next one. Yeah, thank you very much. So the focus of today will be on the first two reports that Hystra has been written on the menstrual health. So the first one being Scaling Up Access to Menstrual Health in the Global South. And then the second piece, which is a bit more focused on the business case for selling reusable menstrual products. So as Sarah was mentioning, we've recently published another piece exploring the synergies between family planning and menstrual health, but we'll hope to share some insights in a future webinar. So we'll focus on these two for today. So if we go to the next slide, let's kickstart this presentation by just reminding what was the objective of these reports. So really the primary objective was to document the best practices from organizations selling menstrual hygiene products to low-income menstruators commercially in the Global South. So to do so, we have leveraged several sources of information. We started with a market analysis of the menstrual health environment in 8 different countries. So in South Asia, it was India, Pakistan, and Bangladesh. And in Africa, it was Ethiopia, Kenya, Nigeria, Senegal, and South Africa. We also wrote 8 case studies on pioneers of the sector that you can see on the map on the slides. So starting with Bangladesh, we studied Joya, which is a disposable pads brand launched by SMC. We also studied a brand called Real Relief, which is an interesting feature of antibacterial material for their reusable pads. In India, we had 3 companies that we studied. First one being Sterile Design, which have created some decentralized machines to produce disposable pads. Akar Innovation, who is also selling disposable pads, but are trying to make them biodegradable. And finally, Cyrona, which is an online platform selling a broad range of women products, including menstrual health, and who has really pushed them for menstrual cups. In Pakistan, we had studied Herground, which is an online selling platform for menstrual health products. And in Kenya and Uganda, we studied Nia, which among other things is selling disposable pads. And in Uganda, AFRIPads, and who is selling reusable pads. And we'll have the privilege to hear from Megan and Yoris a bit more about their experience in selling these products commercially. So we've completed this, these 2 things with some qualitative consumer surveys to really try to understand what it concretely meant for menstruators to have their periods. And I really invite you to look at some interesting pieces that were published by Boppink on this topic, who is our partner on that. And just before we move on, just a caveat in terms of scope, we focused on 3 types of menstrual health products: disposable pads, reusable pads, and menstrual cups, because they are today the most affordable products. And so hence we've decided to focus on these ones, but acknowledging that there are many more products in the market. So we'll share some of the insights today, but before that, let's start with a few questions to ensure that you don't fall asleep during the presentation. So let's start with the first one, Sarah. First question, what is the share of menstruators using disposable pads in the Global South? I'll give you a bit of time to think about this. And yeah, you should have the question popping up in front of your screen. Perfect. So we have some mixed answers, almost a third for each. And I have to give a caveat that the data that I'm going to share is for the 8 countries that we've mentioned, and a bit of a big thank you for the Reproductive Health and Supply Coalition, because these data was collected thanks to the LEAP reports, so very useful to us. Thanks again. And the answer is 55%, so a bit more than a half of the menstruators in the countries that we focused are using disposable pads during their cycle. Next question. So for those who are using disposable pads, how many pads do they use on average per cycle? Less than 2, between 2 and 3, between 4 and 5, or 6 or more? Four and 5 seems to be winning. Yes. Indeed, that's between 4 and 5. And I'll cover a bit more about that in the next slide, if you can shift, Sarah. Perfect. Yeah, so I wanted to start this presentation with disposable pads, because they are today the most used menstrual health solution. And if we start by just looking at the positive trends, there are many, so there are really some good news here. So first, it is the most aspirational solution for menstruators today, because probably due to the large brand campaigns that have been done by the femcare companies over the past 40 years, it's aspirational. And as a result of that, 50%, there is a penetration rate of more than 50% in many of the countries that we've studied. And it's growing at a very fast pace, primarily driven by the young generation that have always known disposable pads. So if we take the example of India, for instance, the penetration rate, if we look globally, of disposable pads is 58%. But then if you focus on the 15 to 24-year-old generation, it's 78%. So it's hopefully a good sign for the future. The second good news is that the prices have decreased over the past years, thanks to several factors. The first one being increased competition. So we are seeing new players coming into the game, like Nia, like Joya, like Nine, and this is helping create some fair competition and leading to prices decrease. Another factor is some tax exemptions that are starting to happening. So for instance, in Kenya, there is some tax exemption, VAT exemptions that also helps reduce the price for the end consumers. Finally, another good news in a sense is that we often hear that disposable pad is a real threat to the environment. So while this is true, it still represents a very small share, less than 0.5% of solid waste. And that is even in countries where women use as many pads as they need for their cycle. So that data point comes from the UK. So in the grand scheme of things, yet there are still some challenges. That means that disposable pads is an imperfect solution. The first challenges that we've seen is the quality of products. Although it's difficult to quantify, they are disposable pads, which is leading to rashes or even sometimes to infection. So you may be aware that there was a social media campaign in Kenya with the hashtag #MyAlwaysExperience that was criticizing the poor quality of pads in Kenya compared to what could be found in Europe. And very surprisingly, there are no international standards for menstrual health products. There is an ISO technical group that has started working on this issue in 2021, I believe. So there is hope that some standards will come up. At the moment, it's not the case. And the key will really be to find the right balance between being strict enough to ensure a good quality of products for everyone, but also being sure that these standards are enforceable by governments, including in the Global South. The second issue is the access to these disposable pads. While in some countries access is no longer an issue, there are still some countries like Bangladesh, Pakistan, or Ethiopia where rural menstruators simply do not have access to disposable pads. In Ethiopia, for instance, 90% of the sales of disposable pads are made in Addis Ababa, which is the capital city. So in these countries, distributors that have some existing routes to markets in these rural areas are really the best place to address this issue. So for instance, I was mentioning SMC, who was already selling some medical products like oral rehydration salts in Bangladesh. And they used these distribution assets to launch the Joya disposable pad brands. And what is interesting is that they managed to gain 30% market share in less than 10 years. So this can really be powerful if you already have these assets to hand. The third issue is affordability, and this is where we've calculated the number of pads that menstruators on average use per cycle. So it's between 4 and 5, as you noted earlier. And even though it's not very clear how many pads do menstruators need depending on their flow, it's way below what we estimate to be needed, between 12 to 15 pads. Some social entrepreneurs like Nia are trying to address this issue, notably by creating longer lasting pads to reduce the overall costs of the menstrual cycle. And we'll hear a bit more about that in a few minutes. I'll just finish very quickly on the environmental challenge. While the waste is limited, it is important to note that it still creates some specific wash issue. So, for instance, some menstruators are throwing the disposable pads in the toilets, which is blocking the sewage pipelines and create both health but also economic challenges to repair that. And in that space, some companies like ACAR Innovations are testing really interesting innovations to have biodegradable pads. For the moment, they are still more expensive than the regular pads, so there is still some R&D to do, but it's an interesting area for thoughts. Now I'll hand over to Megan. Thank you so much for joining us today, and yeah, over to you.
Great. Hi, everyone. I don't know if you can see me. Can you hear me?
Yes, Megan, you're good.
Okay, great. Hi, I'm here in Nairobi, Kenya. My name is Megan McCurry. I'm the founder and CEO of ZanaAfrica. I'll dive in, and as I dive in, I'll share with you our story and my story. So Sarah, you can go to the next slide. Awesome. So this is me on the left at age 21 when I first came to Kenya, and I had the privilege of working for several years with kids who had transitioned from full-time street life to full-time school. And when I came back from that trip, I really realized I wanted my life to be about unlocking the most opportunity for the most girls. I ended up having all of these very late night conversations that we codified as I started ZanaAfrica in 2008, asking girls and boys all over the country what questions they had about reproductive health and safety. And without these answers to questions, kids' lives get really derailed. At the same time, I was the resource mobilization manager, and I found out that sanitary pads were a #2 biggest item of expenses every month after bread. So I felt like I had this unique opportunity to combine these two things, and that's what started ZanaAfrica. So we started a brand called Nia to be able to create what women wanted and what girls wanted. If you can go to the next slide. So as was sort of you heard earlier, low-income women actually demand more from their product. They demand an aspirational brand, but they also demand that it does a lot. Women need to walk long distances, not have any safe place to change their product, and walk home, and then change it. And it causes a lot of burning, a lot of chafing, a lot of very significant problems like bacterial vaginosis and other things that I think you all know. So we decided we wanted to give dignity through choice and offer a range of products. And we do sell reusable products in addition to our disposable products. But the disposable products are our anchor brand because that's what women and girls wanted. So we created a high quality, low cost product that has longer wings, stronger glue, suitable for daytime and nighttime because a lot of women can't afford to even buy a 4-pack, much less 2 different types of products to meet their needs, as you heard earlier. So the only way to do that was to figure out how to innovate large-scale automation. So you can go to the next slide. Oh, and this slide, just to notice, our pads all carry a hotline and a chatbot on it that can answer anybody's questions and direct them to local and digital points of sale. And they're all quite affordable. An 8-pack for 65 is compared against most that are 85 shillings. You can say it's about 85 cents. The shilling's depreciated since then. Next slide. So this is some of our product innovation work that we did with funding from the Gates Foundation and Grand Challenges Canada between 2012 and 2015. We've actually created intellectual property on agricultural byproducts and 9 different pulp blends. So we are able to do this hopefully in the coming years as we raise money to try to find funding for manufacturing, which everybody wants to see happen, but nobody actually wants to fund. So we are looking to be able to have a fully biodegradable product. Our products are currently made in Kenya, but we would like to also make the agricultural byproduct inner core as well. And we are working with ACAR on including the top and bottom layers to be biodegradable. But the top layer does need to be really soft. And right now I'm only seeing photodegradable, not biodegradable products. But this addresses the steps towards a fully biodegradable product. And to note, while sanitary pads are a big issue, baby diapers and adult diapers are a huge issue as well. And our solution can solve that. And I think we need to look more broadly at feminine hygiene products and not just at feminine hygiene products only. So that's kind of answered. Tell us about Nia and why you decided to create this product and how does it address these challenges. We're looking at a potential hybrid pad as well that would have a reusable bottom layer, and then the top layer you could just throw into a pit latrine. That would be very game changing. And then the last question I was asked to talk about is what would you need to grow at a faster pace? So my last slide is the conclusion, if you can go to that one. We're looking for technical assistance, so product development. We're in a new government program, so we are going to be developing diapers, maternities, various other reusable products as well. And economists expand our impact model across a lot of different categories. Engineering, we're looking to start looking at the pulping factory to revalidate procurement and pricing. And we have to do this at large scale because the small scale, we could not deliver the high quality, low cost value proposition that was demanded. It ended up being the reverse, lower quality and higher cost. Supply chain expertise, we need to map the supply chain for the agricultural byproducts. And then we're looking to create a joint venture with our manufacturing partner and a potential US launch. For customers, if you know anybody, institutions are looking to purchase, especially right now with a flood, we've offered a lot of discounts for flood victims. And then investments, grants to transition to manufacturing. I'm seeing a quick question about our revenue. We served over 400,000 customers last year and turned over almost $500,000 in revenue. This year, we're hoping to hit $1 million. So that's it for me. I'll give it back to you guys. If you guys could decide if we're answering questions now or whenever.
Awesome. Thank you so much, Megan. We do have time for 1 or 2 questions. So if anybody does have a quick question for Megan, please go ahead and put that in the chat. And otherwise, we can circle back to any questions at the end of the webinar as well. So we'll give it a quick second to see if there's any questions before we move forward.
What's my ask for investment? We have an anchor investor, Vitol Foundation, and we're looking to close $1 million. So we're looking at about $700,000. We have some grant opportunities for what we call the NIA Health Link, the hotline and chatbot, and that would be we could use anything from $25,000 up to about $250,000.
Awesome. Thank you so much.
And if you want to talk offline, I'll drop my contact details in the chat. I'm happy to send any business decks or have detailed conversations.
Awesome. Thank you so much, Megan. We are going to continue onwards, but please, if you do have other questions for Megan or for any of our speakers or panelists, please do continue to put those in the chat. And Jean, I will hand it back over to you.
Great. Thank you very much, Megan, for sharing your experience. And while disposable pads will continue to grow fast and will be super important, and players like NIA are helping them make them more affordable for the low-income menstruators, it is also quite certain that it cannot be the only solution, and it won't be able to serve all the menstruators. So if you look at the graph on the left, we have tried to show the market growth projection in India. And what we see is that even in this country where the per capita income is expected to grow by 70% in the next 7 years, this growth is unlikely to allow menstruators to cover their full menstruation. So we've assumed that they keep spending the same percentage of their income to disposable pads, and that will lead to 8-9 pads per cycle in 2030, which is still less than the 12-15 pads per cycle reference that we have. So while the cost of disposable pads is certainly the main driver for this gap, there are also other challenges that can explain why disposable pads will not serve all menstruators fully, and that's what we've tried to describe in the table on the right. So first, there is a question of access, as we've seen previously, which can be an issue in some countries. But even when access is not so much an issue, shame might prevent some menstruators to purchase disposable pads. So I was talking to social entrepreneurs in Pakistan who was telling me that when she had her first period, she asked her mom to go to the nearby shop to purchase some pads. And because her mom was a teacher, she said, I can't just go and ask for and purchase disposable pads, even if they're available, because I'm known around and I can't be seen purchasing this type of products. So in that case, having a reusable products that you purchase once every 2 years, 10 years in the case of cup, can help overcome some of these challenges. The second challenge is that disposal, especially as menstrual blood is still very much taboo, can be a problem. Some menstruators do not have areas where you can dispose the pads privately. So here again, reusable products that you keep might help overcome this type of challenges. Although there are other challenges associated that we'll cover a bit later. And finally, the wear time of disposable pads can be a challenge, even though some innovations are helping them last longer. When menstruators are working outside for long hours and do not have access to toilets where they can change and dispose their pads, the menstrual cup, especially, which has a longer time you can use it depending on your flow, could be of interest. So that was just a very quick overview of this reusable products. So let's test you on your knowledge on this and pop up the next question. So what do you think is the percentage of women using reusable menstrual products in the Global South today? Is it less than 1%, 2 to 5%, 6 to 9, or 10 to 12? Give you a few seconds. Well, it's pretty balanced between the different answers, but yes, a majority, 30% of you have answered 2 to 5%. So congratulations, you've already read some of the key learnings from our reports. So if we can move on to the next line, I'll explain a bit more about that. So yeah, what we've tried to do is to understand the penetration rate of these different solutions in different countries. So this analysis is based on 4 countries: Nigeria, Kenya, Bangladesh, and India. And we've tried to understand which solutions were used by whom. And again, thanks to the LEAP data, that was really useful. We've identified that 2 to 5% of the menstruators are using reusable options. The majority and the most used solution remains the home-based menstrual products. That's the red lines that you see, with 30 to 40% of the menstruators still using this as their main solution. And there is an additional 20 to 30%, so that's the light blue, who mix homemade solutions with disposable pads. And one thing that really surprised us during this research, and I would say is one of the key things to remember from this research, is actually the huge gap between this current penetration rates and the theoretical interests that we've seen for these products. And that's what we've done on the right. So we worked with Bopink to interview around 200 consumers and ask them to rank their preferred menstrual health choice. So we did this twice, hence the 2 columns. One just showing the different products, giving a bit of explanation, and then giving more detail, especially on the relative prices of the different products. So what is interesting is that about 30% of the menstruators, so that's the blue lines on the first column, chose reusable options in the first case. But when you actually gave them the price of these products, this significantly increased to 60%. So if we go to the next slide, we're really trying to understand what is the reason for this discrepancy. And that's what we've tried to illustrate with this little graph on the left. So because reusable products are 3 to 15 times cheaper per use than disposable pads, it is also generating much less profits for femcare brands, and hence have naturally received less investments into it. As a result of that, we've seen very few brands, and we hope that we've highlighted some of them that are doing so, but a very few of them are selling reusable products commercially at scale. And because of that, a lot of strong opinion on these products, whether bad or good, are not really backed by any evidence on the market potential of these products. So this is what we've tried to research a bit further. So if we go to the next slide, what we're saying is not that these products are silver bullets. They're not at all, and they face their own challenges, and that's what we've tried to map against a traditional customer journey. So starting with creation of awareness, then first trial, and then long-term adoption. So if we start with the marketing challenges that we can see. The first common challenges between reusable pads and menstrual cup is the lack of awareness. So when Bob Pink was doing this qualitative research, we realized that women were not aware of the products, and especially the menstrual cup. Women were really asking, are you really sure this is something that I can use for my periods? So whenever you have a new product, it naturally comes with some concerns. People have some questions about how to use the products, the convenience, the comforts. So there is a lot of marketing efforts to be made as it was done for disposable pads. But again, that's an investment that needs to be made. The consequence of the products being cheaper and reusable is that you have to pay much more in the beginning to be able to reuse it over time. And hence, even if you might be tempted about the product, there is a perception of risk. What if it doesn't fit me? It's not like a disposable pads. You pay then 50 cents and US cents, and then you can try it. And if you're not happy, you can switch to another brand or switch back to something else. So here, making the investments is a much bigger decision, and hence, needs some convincing. Finally, if we focus more on the reusable pads and the menstrual cups, which is even less known than the reusable pads, which is more or less similar to disposable pads. The cup is completely new, and so it creates additional challenges, especially related to the taboos of insertion. So again, a lot of awareness creation and support in the adoption is really needed to convince menstruators to adopt these products. That was for the marketing challenges. There are also product design challenges, if you go to the next slides, which you can see in a bit darker blue. So one of the things that we've heard from several brands of reusable products is that because of the lack of standards, there are some cheap copycats that are appearing, and that starts to create distrust into these reusable products. The problem is that if a woman has an issue with a reusable pad, let's say, and she won't trust and she won't start buying another brand, and you can tell her, well, it was just a cheap copycat, it won't convince her, so you lost her forever. So this is a big challenge. Another challenge is, in some cases, the difficulty of accessing clean water, which makes the usage of reusable products not always the best solution, and that we have to offer different types of products to fit these different needs. And then if we look at reusable pads challenges a bit more specifically, one thing is that because it's so similar to disposable pads, some menstruators are actually, asking what is the convenience of using reusable pads compared to disposable pads. And because disposable pads has been advertised as a very aspirational solution, sometimes going back to something that you can't dispose is not perceived as a benefit. So again, how do you make that a bit easier for them, especially if you have to dry out the pads in the sun, which is recommended in most of the cases to kill the bacteria. And because of the shame associated to that, well, you know, it's not a good idea for some menstruators. I'll just finish with some distribution challenges, and don't worry, I'm talking about the challenges, but I'll come to the solutions and hope for the future in a few slides. But just to set the scene, the last challenge is distribution, and it's probably, if you could move on to the next slide. Yes, thank you. So that's the even darker blue here. That's probably the most complex challenge to address, because again, reusable products are less profitable for retailers. They will sell less, and so they are reluctant to add them to their shelves. So as a result of that, even if you manage to create awareness, to encourage them to really try the products, sometimes they just can't even find the products because, you know, retailers are not so interested in having these products. So I finished these set of challenges, and I want to introduce Joris, who is CEO of AFRIPads and who's certainly faced some of these challenges. And we wanted to hear more about how you've overcome them and also developed a commercial market for your reusable pads. Over to you, Joris.
Thanks, Jeannie. I'm afraid we have not overcome all the challenges yet. But I'm Joris. I'm CEO of AFRIPads. Next slide, please, Sarah. And AFRIPads is the world's leading social enterprise manufacturing reusable sanitary pads. If you can move on, Sarah. We are based in Uganda and founded in 2010. I think that the challenge that the founders of AFRIPads experienced firsthand is known to all of us, and that's the lack of access to quality menstrual products. And the solution of AFRIPads is a social enterprise that manufactures reusable sanitary pads, quality reusable sanitary pads, locally in Uganda. I think two aspects to mention here is first of all that we are a local manufacturer, so we employ about 100 women in our factory in rural Uganda, and that in itself creates a sustainable contribution to not only the women who work in our factory and their households, but you do see also a sustainable development in the community around our factory, which is very positive. But being a social enterprise means that, yes, we are for profit, but the way what we do with our profit is I think equally important, and that is that we reinvest that in our mission, and that means, or that translates in practice into free education on MHM to all our customers. We are involved in a lot of data collection projects with our customers, provide data collection tools for free, are involved in advocacy in the region, but also, and that's what we talk about today, are really trying to make a consumer market for our products. Next slide, please. Well, the big question, but it's already answered a little bit by Jeannie, is why reusable pads? It's recognizable. If you also compare it, well, with disposable, but more with maybe the homemade products, which is usually made of cloth, old clothes, or bed sheets, and this is also made of cloth, our solution. It is culturally accepted in our region, which is sub-Saharan Africa, where you see a bit different with cups and for instance, tampons, where there are higher barriers. The need for a quality natural products has been explained as well. The quality of disposable products is not always that good in the region. A lot of chemicals which indeed create rashes and so on. And most important, I think, and we'll come back to that later, is the cost effective. On average, it's 6 times cheaper to use a reusable pad. You pay around 3 times more for a reusable than for a disposable. However, after 3 months, you've paid exactly the same, and then you can still use a reusable pad for for another 18 to 24 months. And of course, a disposable you have to buy, if you have the money, new pads every month. As Jeannie already explained, it is, if you look at the preference of the product, you see that if accessible, there is a high preference for reusable pads compared to disposables. This is based on some pilot studies we did in the last 5 years. And also when you compare reusables to menstrual cups. But as said, it's not always available. Next slide, please. So this is what, can you go on back, please? Yeah, this is what our kits looks like. So we have 2 product lines. We have AFRIPads, and that's the brand we sell to our NGO customers and UN. And we have So Sure, which is our consumer brand. In all fairness, about, I think, 90 to 95% of our revenue is AFRIPads. So that's our sales of our product to UN and NGOs, which distribute them to the end users, especially on the African continent and a little bit in the Middle East. That's most of our sales. And then a small part is our commercial brand called So Sure, and that's mostly in Uganda. Next slide, please. So what did we do? Because Jeannie really already explained to us that the challenges for a consumer brand, and I can only say yes, there are a lot of challenges. We really tried different methods to create a market, but I also must be honest. Despite all these efforts, it's still relatively small. Also, when you compare it to our what we call B2B sales. So we tried, and still do. We have our product available in hypermarkets in Kampala, in Uganda, and some smaller shops. We have our own shop downtown in Kampala, where the traders are buying and distribute them. I think so they distribute in Uganda, but not at a big scale. We work together with last mile health distributors, companies like, you have a social enterprise active in parts of sub-Saharan Africa called Healthy Entrepreneurs, for instance. They have local health entrepreneurs and workers who on little motorcycles drive through local communities and sell products. But that includes now our product, but also disposable products, but also aspirins. And but it is a channel for us to really try to penetrate also local communities. We work with reseller models, for instance, women's groups who buy our product and resell in the local community, and they are to also earn a little bit of income themselves. But there they really see also the challenges of price, and of course it's a slow-moving product. So it is you have to buy and purchase your own stock and then resell it. But that's a lot of capital you need to do that, even on a small scale. And then last but not least, we are looking in the region. So we are now only active in Uganda with our consumer brand, and we're looking to expand to Kenya, where the purchasing power is assumed to be higher. So that should hopefully challenge, or hopefully there's a little bit of the challenge we now see with the cost. Because I think at the end, our biggest challenge in selling in a consumer market is awareness of the product itself, but also about the benefits of the product. And especially the cost is the biggest hurdle to buy a product. It's not only so to explain the message that it is a long-term investment that you buy, but after 3 months you are in the money with your investment, and you can have access to a product for free for another 24 months. That's even if you, I mean, it's hard to explain, especially budget keepers are usually still men who find it difficult to say, okay, well, if I understand the message and see it like that, you still need to have the money and to make the decision to buy this product. But if you have to choose between buying this or a kilogram of rice or cooking oil because you really need that, then the choice is easily made, and it will be the food. So there we really see the biggest challenge, and how to market that. And you need big budgets to do that. And yes, we are for profit, and we do make some profit in good years, but we don't make enough profit to fund those type of marketing campaigns. I shared some marketing insights here as well. So where a pack of a kit we usually sell, for instance, to NGOs, contains 4 to 6 pads. For our consumer brands, we already reduced it to 2 pads to make it more affordable, and we now even are trying and piloting with 1 pad to stimulate that a woman can buy a pad, 1 pad at a time whenever there's money for it, and then she can collect slowly on more pads and use them together with, for instance, disposables, and then hopefully at some point she'll have 4 reusable pads or 5 to serve as a cycle. What we also see as a challenge is that when you do market the product, but then, and Jeannie also said it, to really, you have to also have a guaranteed availability, which is a challenge, the infrastructure and distribution networks. So if you go and market somewhere, you always need to keep in mind that you have to have the product available there as well, and make agreements with distributors. We've seen that the small shops are more successful, and it is difficult to sell our products in pharmacies and clinics. It's really the dokus where we sell our product most. Maybe the next slide, Sarah, on where we see we could see some help and able to make the market. Government and regulatory. I think, for instance, very important is, it's already said before, in some countries, there are still taxes on menstrual products. If you take off the taxes, like it is in Uganda and Kenya now, that's a cost saving for the consumer. But also maybe in general, a government that really supports reusable products is something which would be very helpful, also on schools, for instance. Grant funding. You do see that being not an NGO, but a private company, it is difficult to get grants just because we are for profit. There is, so if we could find a way where that would be easier, and we can get grants to do the especially awareness campaigns, that will be very helpful. And the third point is it's a bit the same. I think when partnering between social enterprises or private sector, maybe in general, and NGOs, we are both struggling to find the right way how to do a partnership. I think where we are considered to be a product provider only, I think we should partner. Well, I think in a much more intense way to really see, okay, how can we together try to make this market? What are the market insights that from our private sector perspective can be put on the table? What are our experiences, and what is the experience from more maybe the NGO perspective? And how can we combine the two? So there's, I think, improvements to make from both sides. I already said the distribution network, it's key. You have to have your product available, and that's not always easy given the infrastructure in the countries we work with. So also the distributors should be strengthened. And then last but not least, and that's, I think, a conclusion of everything is, yeah, it is an increased consumer awareness on the benefits of the reusable pads, and that is awareness campaigns, and they're costly, and we cannot pay for those themselves because we just simply don't have the funds. So we really look for partnerships to make that happen. Jeannie, I hope these are sufficient answers to the questions you raised.
That's perfect. Thank you very much, Joris.
Thank you so much, Joris. We do have time for one quick question, so I will pull one from the chat. But Joris, there are a couple others in there for you as well, so we'll let you get to those in writing in a moment. But one of the questions that came up was whether or not AFRIPads has tried to sell via chamas or savings groups, and if so, just any insights from trying to sell in that type of network.
I think we have. But that was before my time. It's definitely something to look into, I believe, and to pilot and see how it could work. The same, for instance, applies to, can you get some microfinancing for this to lower the entry cost and to spread the payment for our product? Because I mean, if you have 2 years, then you can spread the payment. So it's a very good suggestion. It's something we definitely want to pilot on a bigger scale going forward.
Awesome. Thank you so much, Joris. And Jean, I will hand it back over to you for the final part of your presentation. So back to you, Jean.
Great. Thank you very much. Yes, so thank you very much, Joris, because we wanted to hear more about your experience as well as other social entrepreneurs that are trying to overcome these challenges. And what we've tried to do is to really map against the challenges we've noted some of the best practices and inspiration to learn from. And so we have several sources of inspiration, different types of best practices. I'll start just with the product design. I won't cover everything. You can find everything in our reports, but just maybe to mention on product design and the issue of water, which I believe was raised in the meeting chats. We've seen interesting innovation from Real Relief, for instance, and it has developed an antibacterial material for their pads. So that removes the need to use soap to wash the pad, but also dry it in the sun. So you can dry it indoor, which we know can be more convenient for menstruators. So that's something of interest. And another example, before I move on to marketing challenges, comes from EcoFam, which is an Indian social enterprise. And they've designed a pad that, when is unfolded, looks like a random piece of cloth. So you can dry it along with your other clothes. There is no shame associated to that. So there are few ideas that are worth exploring in this aspect. If we move on to the next slide, where I've focused a bit more about on the marketing inspiration. So again, looking at the different steps of the consumer journey. One, to encourage first trial, there are several ideas that we've identified. The first one came from RubyCup, which is a company selling menstrual cup. And for instance, they've started offering a satisfaction guarantee. So where consumers can return the product if they're not satisfied. And you remember when I was talking about the risk perception, knowing that, you know, if you're not satisfied with the purchase, you can return it back, is really helping menstruators make the leap of faith, I would say. And it's also economically viable because in their case, less than 1% of the products were returned thanks to this guarantee. So it really can help create trust while not being so expensive. Another idea is to try product placement in adolescent entertainment shows to normalize these products. You can see the picture on the left is from the TV show The Last of Us that showcased an adolescent girl trying a menstrual cup. And that's had a lot of impact in terms of raising awareness and encouraging product trial. So if you have any ideas of how to introduce these types of products in some local TV shows, I think that's really a really interesting idea to test further. And finally, another thing that we've seen emerge are some online platforms that are advising women on their health and well-being. And there are a few platforms like that. And because they've managed to create a trust relationship with these women, talking about menstrual health, which is not always the case, and talking about these different types of products would also be a good way to, you know, at least create some trust, and in some cases could even link back to where to purchase these products. On the second challenge of product adoption, again, we've seen lots of interesting approaches. One is to leverage community leaders as early satisfied users, whether they're the head of the self-help group, religious group, teachers, youth leaders. Because what we've seen, and this is going beyond menstrual health, and we've seen that in other sectors, clean cooking, energy, we know that personal recommendation is often the most effective marketing tool. So if someone is recommending you, someone that you know personally is recommending you a product, it's much more likely that you will try it out. And building on that, we've learning from other best practices from other sectors. And for instance, in the clean cooking space, there was a company called Toyola, which is a pure marketing model where if someone purchases a product but managed to convince 10 other people to purchase the products, then the person gets reimbursed for its product. So it's really an incentive to generate word of mouth. It's also most cost effective because the sales agents will only come when he knows that 10 sales have been made in the neighborhood. So it's kind of a win-win situation. And finally, in some countries where the penetration of social media is high, leveraging online educational content could be a great idea. So you can see the image in the middle comes from Sirona, which is selling different types of products, and they have a little QR codes, which I think you can't really see on the picture, but they have a QR codes, links to several videos to explain how to wash your products, use it, and you can even sometimes call. I think you can call a platform if you have any question, and they are addressed by your dedicated team. The third type of marketing strategies, but really a bit even broader than marketing, is how to reduce the costs of these products. Again, here two ideas that we found. The first one is to make sure that the products are part of a broader, more holistic health-related portfolio, because this will help limit the marketing, the sales, but also the overheads costs. If you are, one products in a portfolio of 20, the cost of the sales agents, the share of the cost of the sales agents will reduce. And that's what Sirona did. I think they have more than 20 products available. And that's also what helped them reduce the price of their cup to below $4, which to our knowledge is one of the cheapest good quality cups that we've seen. But if you have any other good brands, please share in the chat. And the second idea here to reduce the costs is to leverage some other of the money of other players interested in the benefits of reusable products, whether they're donors or large employers. And this is something that we've seen in India with Shakti, who is actually asking the employers to pay for the cup for their women employees. And the argument was simple, is you are going to reduce the absenteeism, you are going to reduce the drain maintenance, because a lot of women were putting the pads in the toilets. So in the end, you will not pay more by providing cups. In the long term, you will actually benefit from that investment in a sense. If we go to the next slide. Thanks. So looking at the distribution, as Joris was telling us, no one has really fully cracked the model, and more trials will be needed in the coming years to help refine some of the different approaches that could be tested. One is the model of Sirona and Kasha, which are leveraging digital channels to really lower the cost of distribution. One thing, and that needs to be really cracked, is the fact that you need to combine this with in-person support. And for instance, Kasha has done that in some rural areas to ensure that some less tech-savvy people living in more remote areas, which is often the people that would benefit the most from these reusable products, could really become aware and be supported in the adoption of these products. The second strategy, and I won't talk too much about that given what Joris explained to us, but is really about finding the right strategy in retail. So finding champions, as he was saying, not necessarily the biggest one, not necessarily all the retail shops, because unlike disposable pads where you have to purchase it every month, if you just have champions that really believe and push your products, it probably is more cost effective. And the final distribution strategy is direct sales force. By leveraging existing networks, because let's be clear, it's impossible to be profitable if you're only selling one product, especially if it's a reusable one. So the key is really to be integrated into a broader portfolio, and also ensure that the sales agents that will be responsible for selling these products are personally convinced about the benefit of these products. We've seen that, you know, if a woman is not using the product or not convinced, she will just put it aside and continue selling the rest of its portfolio. So all the awareness, there will be no demand if no one is aware that the sales agent is carrying these products in their portfolio. So overall, and if we move to the next slide, there are lots of reasons that I explained previously on why these solutions are underdeveloped today. And there's still a lot to test to find some sustainable commercial approaches. However, we strongly believe that given the current prices of reusable solution, the willingness to pay that we've tested during some qualitative research, the markets for this product could be around 800 million menstruators. So it's really worth investing in more pilots and more tests to crack these markets. And I'll finish the presentation going to the next slides by saying that it's not about promoting one product versus the other. Every menstruator has its own preference. As we've already seen during our qualitative research, they already mix and match different solutions. You can see some quotes on the left here. So it's really about doing something similar to what was done in family planning sector, which is giving choice to menstruators of different products. And this is why everyone has a role to play in the sector. And that's the end. Thank you very much, everyone, for listening in.
Awesome. Thank you so much, Jean. So we do have some time for some questions and answers with our different speakers. And so please do continue to put questions in the chat. I will invite each of our speakers from today's webinar to come back on camera so that we can refer some different questions their way. I have gone through and pulled a couple from throughout the webinar, so I'll start with a couple, and if you have others, continue to enter them in the chat. So I think one of the questions that has come up kind of in different ways and different capacities in the chat throughout the webinar was around sort of this idea of free distribution of pads and menstrual products versus more of a market-based approach where different organizations are selling their products and actually trying to build more of a sustainable market. And I think Joris and Megan, a question for both of you is if you could give us some context around why your organizations have chosen really to lean into more of a market-based approach, kind of the thinking behind that, and then how you do balance that with free distribution of products when necessary. So maybe Megan, I'll hand it to you first, and then we'll hand it over to Joris.
I was wanting him to go first. Okay, that's fine. I mean, retail markets are where people acquire things. So you have a willing population that can pay, right? You look at like the types of marketing like C1, C2, D1, D2, right? You have a market that can pay, but they need higher quality, more affordable products. They can't buy regularly, but they can pay. And so there's great dignity in selling people things they want to buy at a price that they can afford. So that's why retail markets are good. I don't see it as binary. There are especially kids who are in families who have no ability to pay no matter what, and they deserve to have a dignified menstrual experience, right? There are flood victims right now who need a dignified menstrual experience. So we're offering our products at cost to anybody who wants to buy, like, for a decent number of people. So you will always have right now, until we can change global capitalism, poverty, right? So you need to have a mixed strategy. But for any brands to truly take root, I feel like a lot of this social enterprise movement that I've helped to create in some ways since I launched the National Sanitary Towels campaign in 2006 here in Kenya is too bespoke. The questions that are being asked are for like a village, right? And or a region or a sub-county or maybe a county or maybe a country. And Africa is going to have 1 in 4 people on the planet as an African youth by 2050, right? Those are people that need to have gender equality, have all of these things so that they can live prosperous and safe lives and make the world a better place. So they need good retail markets and they need good brands. And you can't shift behavior change towards more use of products or towards more use of alternative products that you want people to use until they really trust you and trust your brand. So having a retail brand allows you to have an authentic, mutually respectful relationship with your end consumer, who you don't just see as a poor person or as a beneficiary, right? And I think that dignity is what we want to instill in everybody. All of us who are on this call, we're here because we believe in the right to dignified menstrual health. And having a strong, powerful retail brand allows that engagement and allows that, sorry, I don't know why the AI on these things is crazy. And allows you to have a strong connection over time with people that for us as well allows to layer in health and safety with our hotline and our chatbot, right? So that you become a trusted partner along the journey. And you don't get that level of trust and relationship from just donations, in my opinion. But there is an important place for donations, but I don't think it's the only place.
Awesome. Thank you so much, Megan. That's such an excellent response. Joris, I'll hand it over to you to see if you have anything to add.
Well, it was a no. There's not much to add, but maybe very simple. I think NGOs in itself, that's just not enough. I mean, they can never replace a sustainable commercial market. It's, I think, where budgets are shifting and getting more limited than limited. But NGOs themselves can never distribute the amount of products needed to address the challenge. So, and only I think at the end, a consumer market will be able to do so, and to which is much more sustainable than distributing for free. So yeah, I agree. It should be a combination, and maybe at the end, hopefully the consumer market will be much stronger and bigger, and giving out products for free will be only in those situations where it's actually necessary, where there's a need, or for instance now where you really have to jump in for humanitarian reasons. But we have a long way to go.
Absolutely.
Unfortunately.
Absolutely. Thank you so much, Joris. And I'm also going to invite one of our co-chairs of the Menstrual Health Supplies Workstream, Tanya Mahajan, to provide any additional thoughts that she has here. I think this question around kind of why markets and why a market-based approach has really underpinned the reason for this joint learning series with the Market Development Approaches Working Group this year. And Tanya has been one of our driving thinkers behind that. So Tanya, I don't know if you are in a good position to come on camera and share some additional thoughts and reflections on that. Over to you, Tanya.
Absolutely. Thank you, Sarah. And thank you to all the speakers for the excellent presentations. I think all the points were very well made. And we're just at the starting point of starting to explore how markets can really help us expand access to menstrual products and services. I'm sorry, I just have to go off for 1 second. But maybe in the meantime, Sarah, we can have the question from Adrian in the chat box.
Yes, and actually, I don't see, Adrian, if you can put your question in the chat. Unfortunately, we're not in a good position to get people off mute who are attendees. So Adrian, if you want to put that question in the chat. I think maybe, Jean, I'll also see if you have any additional thoughts on this as well. I know Hystra has been leading a lot of research and thinking just around kind of the role of markets. So we'll also invite you to answer this. Over to you, Jean.
Thanks, Sarah. No, I agree with what has been shared. You know, there is a lot of, it's very different to consider someone as a beneficiary contrary to a consumer. When you have a consumer, you have to compete and to be in the best position to you know, satisfy the customer. Otherwise, you lose it. So I think it's also a different mindset, and I think is very important for the future. But I think that's all the tests and examples that we're seeing are very encouraging. But again, as Yuri said, for the reusable products, there is a long way to go, but there is hope for this.
Awesome. Thank you so much, Jean. Tanya, I see you back on, so I'll hand it back to you for some additional thoughts there.
My son just came into the room. But yeah, what I wanted to share was that I think in all of these markets that we are seeing, we've come to a sort of inflection point where we are seeing penetration that has increased as a result of disposable pads, and in some cases more on reusable pads. But we are seeing high levels of inequity in this market penetration as well. And I think one of the ways forward that we are seeing, and the data is showing us, is offering choice through the market as a way to address this inequity as well. There are huge parts of the market who are not going to be able to use any one product, and offering a choice of product through the market mechanism, I think, is an important way forward for us to also address those inequities from the perspective of the market as well.
Awesome. Thank you so much, Tanya. We have the follow-up question from Adrian, and thank you, Adrian, for putting that in the chat. So Adrian says, both to Joris and Megan, you clearly understand your challenges as enterprises and the markets that you operate in, and you have your own strategies to get your product to market. Could both of you elaborate on your challenges in attracting funding, financing, and investment? And this time, maybe Joris, I'll put you on the spot first. So over to you, Joris.
Sure. Thanks. Good question, Adrian. I think so. The biggest investment is, I think, around awareness campaigns. We're going to look at reusable pads, especially, and the marketing of the product. And that's where I think we don't have our own funds and resources to pay for those campaigns. It's as simple as that. And that is, hopefully, where we can get some grants and funding in, but so far haven't been really successful. And I think the issue is a little bit, not only what I said before, that we are private sector, and maybe people tend to provide grants to NGOs more easily, or the organizations. But I also think that it is, I mean, we don't have much data, and we don't have really a business case yet, and enough to really say, okay, if you put in amount X, then your return on investment will be Y, for instance. So it's also a bit about collecting sufficient data to build a business case to attract funding. And we first need to collect the data. So it's a little bit of a chicken and egg. Okay, who's going to pay for collecting the first data? Is it us, or is there also some funding available for that? So we can do those pilot studies, test different marketing strategies, test pricing strategies, and so on. And based on that data, try to crack the nut we've been talking about a bit more before, and see if we can scale. And that's, I think, the challenge we face now. So we need to collect data to build a business case, and who's going to pay for that? I think that's a challenge. But Megan, you are also looking for challenging for even building a factory. That's what we don't have and don't see.
Yeah, I would say kind of 4 buckets. First, I think there's like the structural racism penalty. Because if you're an African business, people want you to grow really slowly, right? There's a seaweed tampon that I think sounds really interesting, but they had 100 people trial it from what I've seen on desk research. I don't know the people personally. If they're here, I'd love to talk to you. 100 people raise $15 million, right? We have had this IP for almost a decade, and people are like, well, what can you do for 100,000? What can you do for 200,000? And it's a structural racism issue. And I think as a white American, I need to name what it is because it affects everybody in Africa who's trying to do business, especially more large scale commercial development. It's really hard. So it's a tenacity game. And we're mandated to get positive unit economics per unit at incredibly low volumes. And nobody else is demanded to do that. You look at Uber, you look at all these other companies, they are continually loss making. And there's this huge double standard for businesses in Africa that suddenly have to be like profitable within 12 to 18 months and all this stuff, when that's not how global capitalism works, however we feel about global capitalism. So there's this racism penalty. Then there's a social enterprise penalty, right? People are like, oh, well, you're for profit, so we shouldn't give you a grant. Or, oh, you're nonprofit, but we want dividends. So you can't find the right structure that anybody wants. So that's the second problem. The third problem is the investment committee structural problem. I don't know how to turn that better, but investors and even grant makers, they're looking for this like this thing that fits at the center of a bullseye, right? And it's very siloed, right? So you've got agriculture, you've got fintech, you've got health. But menstrual health is a real cross-cutting area. And so it doesn't fit in anybody's silos directly. And the way that these venture capital and impact investment and grant companies are sourcing is broken and needs to change. And I spend a lot of my time talking about these structural barriers because we have everybody loves us, but nobody wants to fund us, right? Because we're not close enough in that center bullseye. So it's a hard yes. And because it's a hard yes, it's a no. And that's a really big problem. The fourth is that not everybody gets the social impact, right? Some people don't think that just the pads enough, or just the pads themselves are enough, or they think that the pads themselves are great and the commercial strategy is too aggressive, right? And that's kind of my fourth problem, is this what I call the Goldilocks problem. We're either too big now, so sorry, you can't support us, or we're too small, so they're not interested. And then every phase that you grow, you have to start revalidating the whole cohort of people that could fund you, because it's not the same cohort. And so we lack this long-term milestone-based funding that could potentially help a lot of us. So I think those are the problems that I've seen. We've stopped pitching menstrual health. Like we don't talk menstrual health at all anymore. We talk gender equity and health equity. And that opens a lot more doors. Because also, like, men still run the world, unfortunately. We're slowly, secretly taking over as women, but men don't menstruate. So they're the decision makers, and they're like, I don't think it's a big deal. What are you talking about? And they're white, and they don't expose themselves to problems of the majority world. And so these, as a white American, are some of the things that I speak to in the ecosystem to try to change the way funders perceive menstrual health, Africa, large-scale investment, social enterprise, and even the cadence of their funding, right? 2 years, $200,000 is not going to get as far, and you're not going to take the same risks to grow as if you get 150 now and you're going to get another 150 later. So yeah, I'll stop there.
Awesome. Thank you so much, Megan. And Jean, we'll give you a chance to answer this one as well. Curious if in the research that Hystra has been leading on this, if there were any of those sort of upstream opportunities identified kind of around opportunities for financing, or where we might see donors or funders play a bigger role in helping to shape some of the market opportunities. Over to you, Jean.
Yes, thank you. Well, I think that what we've seen is that there are lots of pieces a bit everywhere, some innovations and things that we would like to try more. But as Joris and Megan mentioned, it's very hard to convince donors to trial this more, because some will succeed, some will fail, but it's only like that we'll find a new market to to develop these reusable products in particular. So I think that's it's the issue I mentioned in the beginning. It's less profitable for a company, but also much more impactful for consumers. How do you find this equilibrium, especially if there is no first mover advantage? Because as Joris was saying, you know, even if you had the money to have an awareness campaign, then, you know, any brands that come up after without having invested all this money into the awareness campaign could benefit from it. So it's really a question of, you know, public goods, kind of some investments that are needed as well, on top of, you know, helping specific companies test different tactics and find their own way of developing commercial markets.
Awesome. Thank you, Jean. All right, so we are almost at time for this webinar, so I'm going to go ahead and wrap us up. But I think just a couple of things to share. I think there's a lot of opportunities that we explored today, certainly some questions that remain and how to best build sustainable markets for menstrual health products, certainly a landscape of challenges, but also a lot of opportunities around partnership, around coming together and really building the evidence base and database for better understanding markets for menstrual health products. And then a lot of promise just around navigating new business models that will better serve the needs of menstruators around the world. And so as we said at the beginning of today, there will be several different webinars in this joint learning series between RHSC's Menstrual Health Supplies Workstream and our Market Development Approaches Working Group. This was the first. Our next two are already scheduled. It's a two-part discussion spotlighting the India menstrual health market. This one is being co-hosted with Menstrual Health Action, and the next webinar is on May 9th. Followed by the part 2 of that discussion on May 16th. So RHSC will continue to promote those webinars, and we hope to see many of you in that conversation as well, zooming in on the Indian context. And finally, I would like to thank our co-host for today, Hystra. So thank you so much, Jean, to you and your team for the incredible work that you've been leading, not only in this discussion, but just around expanding opportunities for menstrual health worldwide. As well as a sincere thank you to Joris and Megan for being willing to speak with all of us today. And of course, a thank you to the many RHSC members in the Menstrual Health Supplies Workstream and Market Development Approaches Working Group that really started this conversation and this series with their interest. So with that, we will close for today. Tanya has just put our registration links for the other webinars in the chat. And in the meantime, we will circulate the recording from today and hope to see many of you again soon. Thank you all for being here and have a great rest of the day.
Thank you.
Thanks so much.
Thank you. Bye, guys.
Bye. Thank you, everyone.